Thank you. Well, hello everybody. It's really good to see you. Sorry for those of you that have experienced some problems joining. We've got a few people arriving as I speak, so we'll just have a very slow start, and welcome to all of you. Thomas, are you okay to share your screen?
Yes, let's start with the slides. I'll share my screen and then the slides, and then we can make a start. Okay. How is this?
Great, thank you, Thomas. And hello everybody, and welcome to our MASc in Creative Health information session. Apologies again to those of you that have experienced any problems joining us. People are still joining, so welcome. My name is Helen Chatterjee. I'm the Programme Director for the MASc in Creative Health, and I'm joined today by Thomas Kador, who is our admissions tutor for the programme, and a really special guest, Esme Elsden, who's one of our BASc undergraduate in Arts and Sciences graduates, and she'll tell you a little bit about why she's here. She did our Art, Nature, Wellbeing module. So I'm just going to start with a few bits of information really about the programme, then I'm going to hand over to Thomas. So the first thing to say is I think you've already got the Slido link. Please do use that to post your questions. So to start with, what is an MASc in Arts and Sciences? Well, the focus of our programme is very much about interdisciplinarity, and what that means is that we're drawing methods, concepts, ideas and knowledge, data and evidence from a whole range of different subjects. For us, that includes a whole spectrum of arts, humanities, sciences and medicines. And that's really important for a topic such as creative health, because we need to understand how these disciplines interact, but critically how they play out in the real world. So what do we mean by creative health? Well, creative health is defined as creating the conditions and opportunities for art, creativity and culture to be embedded in the health of the public. And hopefully you'll get a better sense of that as we talk through today's talk. So what we're going to be talking to you about today is why you might want to come to UCL and study creative health. Next slide, please, Thomas. The term creative health was coined in the All-Party Parliamentary Group for Arts, Health and Wellbeing's 2017 Creative Health Report. And in this inquiry report, you can find over 1,000 different references to research articles, studies, projects, programmes, evaluations and other types of grey literature evidence that describe the significant contribution that arts make to health and wellbeing. And in that report, there are 10 recommendations. One of those recommendations, recommendation 8, is specifically around providing education and training opportunities to draw people closer to the understandings around how arts contributes to health and wellbeing. So if you're not familiar with the APPG Creative Health Report, go and have a look at it, and that'll give you some good insights into what we mean by creative health, both from a research point of view, but also from a practice point of view. And it draws just some fantastic case studies from across the UK and beyond, from across the life course as to how arts and creativity contribute to improving health and wellbeing. Next slide, please, Thomas. And finally, before I finish, I want to talk about one other major area of work that we really draw upon within the MASc in creative health, and that's around health inequalities. And we've all heard a lot more about health inequalities, haven't we, in the last year or so. We know that the pandemic has adversely and disproportionately affected the poorest people living in the poorest communities. And what we also know, and what Michael Marmot and his team said, is that a range of social factors need to be taken into account if we want to alleviate health inequalities. We know that the NHS alone cannot reduce health inequalities, and we know that social networks and local communities strongly influence individual health and wellbeing. And this is really where creative health and creative health partnerships and engagement with arts, culture, creativity, and we would include in that nature and the outdoors, how that contributes to health and wellbeing is really, really important if we really want to think about health inequalities. So I'm going to hand over to Thomas, and he's going to tell you more about our degree structure and what you can expect if you come to study with us. Thank you, and over to you, Thomas.
Thanks, Helen. Yes, I'll talk to you briefly about the structure and then some of the other things you might want to consider in relation to applying. In very simple terms, it's generally a 1-year degree, although there is a part-time 2-year option. Either way, you would end up taking 180 credits worth of modules. Most modules in UCL are 15 credits, so 4 of those 180 credits would be compulsory modules. There is Arts, Nature and Wellbeing, about which we'll talk a little bit more with Esme, because she has taken this, approaches to interdisciplinarity, public engagement with research, and research methods in arts and sciences. In addition to these 4 core modules, every student will also be able to take 2 optional modules from anywhere in UCL pretty much. Obviously, they should link and relate to some way to creative health, but that can be a very broad approach. And there's some examples of some of those optional modules are already on the Master's Creative Health, Arts and Sciences Creative Health website for you. And then, so these modules between the compulsory and the optional modules make up half of your 180 credits, and the other half, the 90 credits, are made up by a dissertation project, which is a community-based dissertation project. So I'll say a little bit more about this in a minute. And with so this relates to the dissertation project, and it also will answer some of the questions that you have already uploaded on Slido, and that is about the community partner organizations. So each student on the MASc Creative Health will do a dissertation project with a community partner organization. And here is just a selection of the partner organizations that we have already links with, that we've worked with for a number of years. And these are largely London-based, but there's a whole range, as you can see, anything from very small neighborhood organizations like the Hackney Playbus, for example, community-based organizations, to very large national organizations like HUK, as well as NHS trusts like the UCLH, University College Hospital. So there's a whole range, and the idea is that each student will spend for just under half of the academic year with working very closely with one of these community partners in producing their research project, or co-producing essentially their research project. And we can talk more about this. If there are questions, please put them in the Slido. I won't say very much about this, but we have a strategic partner. And you can probably see the links with the Creative Health report that Helen already mentioned. And this is the National Centre for Creative Health that was launched earlier this year. And they are a strategic partner of the program, and we're very glad to be able to work so closely with the National Centre. And essentially, we are 2 sides of the same coin. That out of the recommendations, some of the key recommendations made in the report were: 1, to set up a national centre, which is the National Centre for Creative Health, and 2, to set up more educational and training facilities for people wanting to qualify in creative health. And that's what our degree, what our master's is all about. So these are some of the key recommendations from that report. And then a few points in relation to why you might want to consider, or who might want to consider applying for this program. I guess all of you are here because you're interested in potentially applying, or most of you. And you could have broad research policy practice interest, so that could be quite broad. The key is, I guess, that you would be interested in thinking about careers in the health or social care sector, but it could be quite broad, from arts, culture, creative work to the health service or care sector, including things like social prescribing, and of course working also in the non-governmental or voluntary sector. So there's a whole spectrum there, but anything to do with linking the non-clinical world of creative lives and arts with the health services, essentially. And linking to what Helen has said, one key element clearly is an interest in addressing the very striking health inequalities that exist in this country as well as elsewhere. And with the COVID pandemic, for example, has showed them obviously up very strikingly. So it's about addressing those health inequalities and thinking about social determinants of health. So if you're interested in these areas, then it sounds like you might well be in a good place thinking about applying for our program. There is obviously the other side. I'm not going to oversell this too much, but UCL obviously is a well located and very good university. It's usually ranked around the 10th in the world. It's one of the best in Europe, and it's also, I think, in terms of research in Europe, it's probably the foremost university in Europe. So it's obviously a very striking university, and post lockdowns, hopefully next academic year, it's also obviously located in central London. So having access to all the other cultural facilities that central London has to offer is clearly a great asset of UCL as well. Very briefly then, and we can talk more about this in the Q&A, there are two sort of admissions routes. The standard route would be with an undergraduate degree of 2:1 or above. And it could be almost any kind of qualification, again, that links broadly to creative health, whether that is in psychology or medical sciences, medicine, or nursing, or the life sciences, but also the arts, both actually creative arts, fine arts, as well as arts in terms of humanities and social sciences. So this is the standard route, but we are conscious that people might want to apply for this program who didn't go down that standard route and didn't get a 2:1 on their BA, or don't maybe have an undergraduate degree at all, but who have lots of experience to draw on, who have lots of personal or professional experience of working, for example, in the health sector or care sector. So if this is you, if you think you have lots of experience you can bring despite not having that 2:1 undergrad degree, then do come and talk to us, because there is this alternative entry route that would allow you to study with us if you meet that criterion. So this is pretty much all from me. Again, you have the email address there to contact us with any query, and the Twitter handle, and you probably have found the website in order to book this event. So I'll hand you over to Esme now, and I'll stop sharing my screen.
Thanks, Thomas. So I'm Esme. I'm a PhD candidate in the Institute of Epidemiology and Public Health, which isn't so sciencey as I promise as it sounds. I'm actually doing an interdisciplinary PhD, which is in looking at biosocial frameworks. So it's trying to integrate social science and biological sciences. So I'm still pursuing interdisciplinarity here. So a little bit about why I'm here and why you might want to hear from me. I did the Bachelor of Arts and Sciences as my first degree, and I was very much heavy towards the arts and humanities, very much had admissions within the creative industry and the creative sector, rather than so much the health sector, as that was my minor. But what was brilliant about my BASc degree is that I got to final year and there was a core module that had come up that year called Arts, Nature and Wellbeing. And this is one of the core modules that has become part of the MASc. And I was connected to the University College London Hospital, a partnership, working with Guy Noble, who had, if you've been to any of these another MASc event, he was also at one of them. And I had a 5-month project, I think it was, for Arts, Nature, Wellbeing, which was daunting to begin, but I promise you it was the most rewarding module that I did within my entire degree, bar my dissertation. And it was probably the only time that I felt that I was doing a module that had actual impact within the actual real world. And I know that sounds like, what else were you doing in your degree? But that's what's so important about this area. And one thing to really take away about creative health is that it's a fascinating and fast-paced growing area with actual change for both research, policy and practice. So where it led me is, so I did Arts, Nature, Wellbeing, really loved it, was based on a acute older persons ward at UCLH, and it was with Guildhall School of Music, and what I had to figure out was a way to evaluate whether the people on the ward were enjoying the music. And it was a whirlwind of upskilling and figuring out, how do I evaluate people that don't want to be evaluated? How do I figure out what does even evaluation mean? How do we measure, what's the value here? what's a good change, a bad change. And it was a steep learning curve, but one that I would recommend to anyone who is interested in the creative health field, because it teaches you more than you know. So that then led me into my dissertation, which I did with Helen, and also Dr. Linda Thompson, who and that was looking at stroke inpatients on a Trafford General Hospital ward up north, where Helen had done a project called Not to Come Up North, and there was a lot of data using community assets in Manchester on these different dementia and stroke wards. So I was specifically looking at stroke wards, and that was using the Manchester Museum and Whitworth Art Gallery data. And that has led to a publication looking at the Whitworth side of things, which is more about a green prescription. So figuring out what are the components of a social prescription that's going to best support your different service users. So these were mental health service users, and really for them, what was the most beneficial was having a 3-part intervention. So it was looking at something that got them using their hands out into the gardens and looking around, and also using their sort of stimulating their brain a bit more and doing more, and also the choice of it. So it was also being able to pick and choose within that framework of the 3 activities that they could get involved with. Similarly, the stroke also had a 3-part component to it. So I'm digressing. Lots of interesting parts to those 2 projects, and it spurred me on. So a lot of people, I think, come to both BASc and possibly with the MASc asking, well, what's the trajectory of my career? Where can I go with this? What do I do next? And for me, I've now gone on to doing a PhD, and I've very much kept to, what has fundamentally helped me on my CV was that project with UCLH, with Gary Noble. It was doing the Arts, Nature, Wellbeing module, because I talked about that in interviews so many times. It led to working further with Helen and Thomas and Linda on more research projects in the summer, which then led to further publications in the works, which then allowed me to really be in a strong position to apply for an interdisciplinary PhD because of the amount of mixed methods and interdisciplinary research methods that we had done previously in these projects. So that's all very academic, and that is a very much one-track academic train that you could see that I have done. But actually, it's not the only part to the beautiful part of doing interdisciplinary work. Off the back of working for the UCLH and Gary Noble project, I then got a job at the Science Gallery London down at King's, and then I started to work there as more in the sort of the museum side, and that then led to further work that I've worked on for my master's, which was looking at what types of leisure activities people do, what kind of frequency they're doing, and what health domains they sort of tap into, which then has led me to being able to apply for the Public Health England internship, which I'll be doing this summer. So it's not just an academic route, you've also got the creative sectors that you can then tap back into. You've also got the health sectors if you want to tap into them. It puts you in such a strong position that you are able to be a broad and wanted individual in these sectors, because you need to be able to look at both. When you come into a creative health field, you need to be able to think creatively about health. So I think that is kind of what I want to say. I can say more, there's lots of other things that have happened, but majority of the time it's always come back to the fact that this course gave me an ability to understand what community assets were, how important they were to community, how important it is to think creatively when we're tackling big societal problems such as inequality. And I really cannot recommend further interdisciplinary inquiries as a postgraduate route for anyone, especially if you've come from a monodiscipline as well. If you've just done, say, solidly, whichever undergraduate degree, if it was interdisciplinary or monodisciplinary, there is always a route here that takes you in a new and interesting place. So yeah, that's what I have to say. If there's any questions, I'm about.
Brilliant. Thank you very much, Esme. Really great to get your insights from having done the module, which these students will do, and then where that's taken you. Really helpful. So now, guys, it's over to you. And I think, Thomas, we already have some questions that people have presented in Slido. If you do have other questions, post them in Slido. There are several questions there you can see already, so you can upvote questions if you'd like us to tackle those. We will do our best. We've got just over half an hour, so we'll do our best to tackle as many of these as possible. I'm just going to open up my Slido screen.
Yeah, I can read out the questions, and then we can take turns to respond to them. Some of them are very practical, and others are more conceptual. So the first one is, and there's one lower down, I think, about the number of places and the predicted application to offer ratio. And essentially, the cap for this first year is 25 students, and the ratio really depends on how many applications there will be in the end. We can only offer 25 places at the moment. And as you have probably seen, UCL have brought forward the application deadlines. It's the end of this month. It's the 31st of May. So I guess the best I would suggest is I wouldn't worry about the ratios. I would just apply if you want to apply, if you're in a position to apply. I don't know if Helen has anything else to add on this, but yeah, we can offer 25 places this year.
Yeah, and I think, you know, from our perspective, if we do get lots of applicants and we want to make more offers, I think it makes a really good case for us to go back to UCL and say, Central UCL Admissions, to say we would like, yeah, we would like more places. And definitely our quota increases year on year. So we will be able to, I can't remember, Christy might remember what our quota is for the following year.
I think it's 35, right?
Yeah. Yeah, so we are increasing, and we may be able to increase further.
Okay, next one. Can you give an example of specific jobs that require the skills gained in this degree? Maybe this is something we can bring Esme in as well. I don't know, Helen or Esme, who wants to take this one first?
Yeah, well, I mean, this is the sort of thing that we get sent a lot of jobs actually through, for example, things like the Culture, Health and Wellbeing Alliance. That's another one of the partners. We have their logo there in our list of partners. That's a national organisation that we set up 3 years ago now. We have around 6,000 members who work across the sector. Those are the sorts of jobs I imagine that people will be interested in, and that there are certain opportunities in those areas. Now, those individuals who are our members, they work across a whole range of organisations. In fact, one of them's with us now. Nikki Crane's joined us. She might want to talk about the kind of work that she does. She's been doing this work for a few years, like me. Individuals come from different backgrounds, but work in very different settings. So, for example, within the NHS, we have, for example, arts coordinators that work in hospitals. And Esme mentioned Guy Noble. He's one of mine and Nikki and Thomas's colleagues that we've worked with for many years. And there are many such posts, so hospital arts programmes. Increasingly within arts and creative organisations, we are seeing well-being posts. Museums are starting to appoint coordinators that are targeting communities and well-being work. And then there are sort of jobs like social prescribing link workers and those more community-based posts. They might initially have been called navigators or community health navigators, essentially people that are working at the interface of health and communities. Now, they're sometimes employed by NHS trusts, they're sometimes employed by GP surgeries, individual GPs, or primary care networks, or local authorities, or indeed within the third and voluntary sectors. So really a wide range of different types of jobs that already exist and that we're starting to see increased numbers of, which I think is really, really fantastic. We can't, it's really difficult in our area because, as you see, it is very interdisciplinary and all of us come from very different backgrounds. I can see that Nikki's got her camera and she might be prepared to tell you a little bit about the fantastic work that she does. She's based at King's, but has run a consultancy around arts and health for many years and really is one of the leading lights in arts and health. So I don't know, Nick, if you're prepared to just tell people a little bit about the sorts of work that you do.
Yeah, sure. I think my post is, I wouldn't say unique, but there aren't a huge number of them around. But I mean, how exciting it is, you know, at a university to have somebody leading on arts, health and wellbeing, and being able to sort of curate what that means as well. I mean, I think these jobs are very creative and they're a sort of movable feast. I mean, obviously, you have your aims and objectives and you know how you fit into the university's vision, but because we're working across sectors all the time, there are so many influences in our work. I think that's what makes it so exciting. So you feel like you're co-creating what you do in your institution, which is fantastic. And just to add to what Helen was saying, I've managed to make a freelance career out of arts and health for really some time now, and done some incredibly exciting work with galleries and museums and theatres. And, you know, so many companies now, I mean, recently I've done some really wonderful work with Scottish Ballet because of their pioneering spirit and what they want to do in the dance field in Scotland. So, you know, to be able to work with a ballet company. So, you know, a lot of the large companies have got outreach departments, education departments, as you probably know, and are getting more and more creative about how they work in arts and health, and then a lot of grassroots work as well. So I guess the joy of my work has been 1 minute working with a tiny little organisation in Southwark at a grassroots level, might be around social prescribing or just, you know, creating the right kind of projects that will work in that community. And then the next minute you're scaling up and, you know, working with the National Gallery or, you know, Tate on some of their programs. So yeah, just to give you a flavour, there's a lot in the freelance work as well as in the employment industry, without a pension though, I'm afraid.
And that's so fantastic. You've got your post as well at King's, Nikki.
Yeah, the King's post.
So much for sharing your experiences, and I'm also pleased to say that thanks to Nikki and other colleagues at King's College London, they're going to be offering one of the dissertation projects to link in with one of their big research projects that they have there called the Shaper Project. So that's really excited to be working with you. And Esme, I wonder maybe you might want to just say a few words about you're doing a PhD now. You've got your fantastic internship happening over the summer at Public Health England. Maybe I could put you on the spot and ask you, what are your hopes, dreams and aspirations? What do you want to do after you've got your PhD?
Oh, good question. The $1 million question. I actually think that's kind of one of the beautiful things about creative health and going down an interdisciplinary route. There's so many different avenues that you look at and you can go down. So it kind of gets to the point of, well, what's project where you start to build a network of people that are really in this space and really loving this space. And then it's a fast-paced one as well. So there's so many options. I would love to still be in a teaching capacity. I'd love to get a postdoc or sort of stay in the academic world with the research side a bit more. Equally, I think there's a passion project of mine probably to go into Public Health England or go into the Department of Health and be like, hi guys, let's shake things up. You're already starting to get onto the social prescriber movement. Matt Hancock's pledged, I think 3 million, is it, or something like 3,000 link workers for the next 2-3 years. There's the cogs are going, and it's just a dynamic space. But I think what's great about the core modules of this degree are the fact that they keep you open. So I know that it sounds scary to a lot of students when you get told the world's your oyster. You think, well, what oyster? Where's the pearl? And actually, I am being my own self-fulfilling prophecy, but I do mean it wholeheartedly when I say that the skills that you get from interdisciplinary work, from having research methods that span both qualitative and quantitative, are just so necessary in so many different types of jobs, whether you work for a research institute such as the Anna Freud Centre that's looking at child health, or whether you go and think about working for, say, Age UK or Dementia Friends, and you start to think a bit more broadly about what it is to live in a well society. There's so many ways that these skills that you will get on this degree will help you figure out your next step. And maybe you don't know it when you go into it. And then maybe these projects will help you figure out a little bit more what you like, what you don't like as well. It's fine to not like certain things. You don't have to love every part of your degree, because that's not good either. So I think there's lots of ways that these next steps will become apparent as you work through the year. And also, Martin, I know that you put a message in the Slido asking about working part-time, full-time, and also doing a master's. I just wanted to say for everyone that during my own master's, which was not the MASc, I worked part-time, but I did it full-time. and it was a balancing act, because I was working between being a research associate with Thomas and Helen, as well as working for the Science Gallery, and then also starting my master's. So there's ways to juggle it. It's just up to how you work as a person. I think it's a very personalized question, actually. If you know that, for example, you can get a lot of work done in 2 hours, that's going to tell you something. It depends on the reading amount as well, and how fast or how much more time you need for that. But yeah, depends.
Thank you, Esme. Well, and the sooner we can get you into the Department of Health to shake you up, the better.
I mean, it's always being shaken up in different ways, but I would love that. It'd be so fun.
Not that I'm saying it necessarily needs shaking up, but all government departments require shaking up at some point, don't they?
Regularly.
Process.
So we've got some other questions. You raised Martin's question about part-time and full-time, and I can see in the Slido, Thomas, that we've got some other questions about that. So should we tackle that?
Yeah, let's just take those then together, I think. So there's one, whether there's a part-time option, and also whether it's an option of distance learning, or if it's campus-based, and also how the part-time and full-time course or option interact. And then there's Martin's question about whether it's feasible to work part-time and actually study the full-time route. So yeah, let's tackle those together. Maybe I come back to, if you remember the slide we had on the credits. So the part-time route would be essentially exactly half. So it would be over 2 years, and the expectation is that you do 90 credits a year. So that means, in terms of the interaction between the part-time and the full-time, that the credits you do, the modules you take together with the full-time cohort. So there's no separation of the two. You just have some modules we say are essential to start with, like arts, nature, well-being, and like research methods. You need to take them in your first year. And therefore, the other two core modules on lived experience / public engagement and interdisciplinarity you would take in your second year. And in each of the years, you take one of the optional modules. And the dissertation in the part-time version would then run through the 2 years. You would start in the first year, would obviously then intensify and submit at the end of your second year. So this is how the two intersect. But at the moment, we are not in a position to provide an entirely online course. Of course, if everything has to go back online, hopefully we are through this, and fingers crossed with COVID. But as long as everything returns to some form of normality, we don't have the capacity to run. Essentially, would be running two parallel things, and we don't have the facilities. It's something we're looking into, but not at the moment. So at the moment, it would be expected that everybody has a presence on campus. And that's my final point, and hopefully that responds to Martin's question, and then maybe Helen wants to come in as well. That is that we are, even with the full-time course, we are trying to concentrate most of the thought, the contact time, the thought classes on 2 days a week. There may be a third day with the optional module, or there may have to be a seminar at some point on a third day, but we're trying to have almost everything concentrated on 2 days a week. And therefore, hopefully and that's the full-time version. So with the part-time, that load would even be slightly lighter than that, but probably still be spread over 2 days. It would be very difficult to see with the part-time how it could only be on 1 day, but it would probably be then more like 2 half days a week on the part-time, and full-time 2 and a bit days over any given working week. And when it then comes to the dissertation, there's then even less contact time. There would probably be 1 to 2 seminars a week, and most of the time expected to work with the community partner organization, which you can work around your schedule. But having said all that, it is still going to be very intensive. So it depends really on your workload outside of your part-time freelance or the clinical workload outside of the studies, to what degree you feel you can balance this. I don't know, Helen, if you want to add anything to that.
Yeah, well, I think you've hit the nail on the head really in terms of managing your own time, but also the reason that we've concentrated the contact time, and remember what we're talking about here is the contact time as us all as a group. There will be other times that you will be expected to spend time with us and or each other. For example, there's a big focus on smaller group work, but what we've done is try to leave that more flexible so that we can then arrange that around then any other commitments you've got. So for example, as Thomas says, your optional modules, we have to slot in around that, and then any of your sort of in-course assessment work, your other sorts of group work that you might be doing would then fit in outside of those official contact time. So those sorts of times are more flexible, and hopefully you can fit that around existing priorities a little bit easier.
Catherine just fired in a follow-up question about the 2 days a week, whether they would be consecutive days. And this is really an issue with UCL timetabling. And it looks most likely, Christy can correct me, or Helen, if I get this wrong, it looks most likely that the intensive days will be Tuesdays and Thursdays, I think, with potentially a seminar having to move in one of the terms to Wednesday. But most of the focus will be Tuesday and Thursday. So not consecutive, but if you wanted to focus on being in London, if you live outside London, Tuesday to Thursday, then you could focus Wednesday obviously on the coursework and the reading that needs to be done, and have spend Tuesday, Wednesday, Thursday in London. But that's just a thought. Yeah, but Christy, am I correct? Tuesday and Thursday will be the intensive.
Yes, yeah, that's what we're finalising the timetable in a couple of weeks' time. But Tuesdays and Thursdays is what we're working towards at the moment.
Okay. Something more broad then, and this also relates to another point that Esme was making, I think. Is the course more locally focused, or is there room for global growth and implementation of the skills for students with who attain this degree? So is the course locally focused, or what are the global possibilities?
Yeah, shall I have a go at tackling that? I mean, so the first thing to say is locally focused in the sense that, as Thomas says, we will be based on the UCL campus in Camden. And so a lot of our partners who contribute sessions, for example, to Art, Nature, Wellbeing, and our other module, a really important module for us is the public engagement and lived experience with research. Most of those partners will be fairly local, as in they'll come from in and around London. That's simply because it's easier for them to get there. And a lot of the work we do, sometimes we'll be going out to visit them. So we'll be doing a session in a local park, and we'll be going to museums, arts organisations within London. When it comes to your dissertation, there we've got a lot of flexibility. We've been really, really fortunate to have a lot of organisations be very keen to work with our students and to work with us as a programme to offer dissertations, as you've heard from Nikki and from the Shaper Project, many other different organisations who have offered. However, if you are planning, for example, you would like to do your dissertation with an organisation, say you're already involved in, that's absolutely fine, or an organisation that is perhaps local to you if you're not from London, that is also absolutely fine and to be encouraged. Really what we would say is that we would obviously have to work with the student and that organisation to check that everybody's on the same page in terms of what the objectives are critically for all of those different partners. So obviously, most importantly, we need to make sure that you, the student, gets from that dissertation what you need. It is an important piece of research. And likewise, equally important is that that partner organisation gets what they want from that arrangement. And the way that we do that is that we basically have a conversation with the organisation to help them identify what are their priorities that would be beneficial for them, for a student to help them work on it. And as Esme's talked to you about, a lot of that is often around research and evaluation. It might be around evaluating some existing work that's already going on. It might be around examining existing data that exists. We've had students helping, for example, organisations draft policy documents, strategy documents, grant applications. So a really wide diversity. We've had students doing a lot of work around community development, helping to develop new programs, pilot programs, and then do some testing and evaluating around developing pilot work. So they're really quite broad, but the number one thing really is that the organisation really decides on what the areas of interest are. And what we do at the supervision end is help shape that into a feasible research project so that both parties, the student and the community partner, get something out of it. In terms of global growth, and particularly, I guess, if there's any international students joining us, arts and health is really big internationally in lots of different countries. In some countries, things like social prescribing are fairly new, and these are new types of mechanisms for connecting up health and arts and cultural organisations and other sorts of community organisations. And in some countries, this has been going on for many years. So in places like Canada, the USA, places like Singapore, Australia, those countries have been doing a lot of this work for many, many years. But we're seeing increasing practice across places like China, Italy, Germany, the Netherlands have been doing lots of this work for a long time. Finland, Denmark, Sweden have also been doing this work for a long time. So there's a real plethora. And you might be thinking about, or you might be coming from a country where there isn't a huge amount of practice. But what we can help you do is, so we have a really good network internationally of people who are, for example, members of our Culture, Health and Wellbeing Alliance, who are based internationally. Also, we partner with the Social Prescribing Network. They have a massive international partnership. And so we can help reach out to local partners within, if you're coming from a different country, and we can help you understand if that is something that would be of interest to you. We can help think about how that sort of dissertation-based aspect might work with something a little bit more local to you if you are an international student. So I hope that answers your question, Anonymous. In terms of global growth and implementation of skills. Yeah, and I mean, definitely in terms of what we've seen over the last few years, thanks, I think, to the APPG report and the increase in social prescribing, is, you know, a lot of people are looking to the UK for kind of how we do this and what we do. And people like Nikki and I get asked to join lots of different meetings and events and activities to support individuals internationally. So we know there is a lot of growth internationally, but I think therefore your skills will be in demand, and that's why we're so keen to, you know, make sure there's more of you that have those sorts of skills and that expertise and the experience to share that practice and take that forward into new areas and new countries, new geographic locations, new types of organisations. We're seeing many more links now between arts and culture and nature and the outdoors. So I think there's increasing opportunities there. So I hope that answers your question.
Yeah, just to add also, in terms of the global focus, we obviously have a long-standing collaboration with David Osrin, who's UCL Professor of Global Health, who contributes to Arts, Nature, Wellbeing. So we do present a global perspective. It's just that for logistical reasons, most of the partner organizations and therefore most of the dissertations will be more locally focused. But it's like the old green adage in terms of think locally, think globally, act locally. Think globally, act locally. So that's sort of the idea as well with arts and health, I guess. There's a big movement there, but most of the projects will be locally. But for the people like the person from Scotland who asked if they could do the dissertation based there, as Helen said, that would be perfectly fine. The key is, once you have applied, once you have accepted your place, then start a conversation. If that's what you're planning, bring the organization to us in a conversation, because there will be some formalities that will have to be done in terms of setting up that partnership. So if you're planning to work with an organization that's not already a part of our network, then if you have a very specific one in mind, whether it's in London or elsewhere, then do come to us with that as soon as you can, so we can start a conversation with them. I think it just today in Helen's lunch lecture, we just had an offer from Arts Lift Gloucestershire out of the blue, wanting to work with us. So this happens all the time, and we're happy to facilitate that. Okay, how many of the teaching staff actually have health science degrees? Helen, do you want to start with that?
Yeah, well, I don't have a health science degree. I have a natural sciences degree, actually, natural environmental sciences. So, well, none of us have a health sciences degree. Health sciences is quite a specific degree program. I actually teach, I taught for many years and I get students from our health sciences at UCL is called biomedical sciences. And we have another degree called human sciences. So those are both quite similar to health sciences degrees. So yeah, we all come from quite different backgrounds. I'll let Thomas tell you a little bit about his background. I did a PhD in zoology, and I've worked on climate change and biodiversity loss for many years, and that really got me, I guess, the skills. I come from essentially much more of a quantitative, I work in a biological sciences department, and so I come from the sort of gold standard randomized controlled trial, more clinical aspects of sciences. In terms of my background. But when I first came to UCL to do my PhD, I started running a museum. And that's what made me realise that you really need to have a really wide diversity of both methods, practice, understanding of policy. And because of that, you need to draw from many different disciplines. And I'm really lucky to be based I'm based both across biological sciences and now arts and sciences. But I've been in our biology department for 25 years. We're a very broad church, so you may have some thoughts about, you know, a health sciences degree is a very specific focused discipline, but actually many of those subjects, and like I say, I teach students on health sciences degrees, and they actually tend to come from very broad backgrounds as well. And so you may think you come from a very narrow focused discipline, but what we're really talking about here is the importance of interdisciplinarity. And as Esme really beautifully articulated, it's really important to be aware of those different disciplinary perspectives, methods, and we're going to be drawing from those within this programme. And that is really crucial. And it's crucial as we start to tackle these major issues. And that's why people like Michael Marmot talked about things like the social determinants of health. Having a purely biomedical focus on health has not done us any favours, and it really, really has caused many issues for essentially the poorest people in society. So funneling those people into multiple services when they have complex needs and complex health problems actually does them a great disservice. And we think that this more creative approach to health actually is a much better way of tackling health inequalities. And if you're not convinced by that, then please read the Marmot Review, all three documents, the 2010 one, the 2020 one, and his recent COVID-19 report, because that will really give you a very good understanding of why it's so important to go outside the biomedical model. So I hope that answers your question. Thomas can now tell you about his exciting book.
The Marmot Reviews can be a summer reading if you come in to study with us. Will be essential holiday reading. Yeah, I won't bore you with my CV, and maybe Helen already started to answer the next question, which is about the concept of interdisciplinarity. So we might be able to tackle the two of them together. In a way, I think key is that this is not a health science degree. Health science, as Helen said, is actually more diverse than it might seem, but it's still obviously primarily focused on the biomedical model of health, and that's not us. You know, our degree is about health inequalities and approaching them from all sorts of perspectives. You know, we don't dismiss anything. There is obviously the traditional biomedical models, they are there, but we want to work with them in tandem with different models, whether that's alternative medicine models or arts and health, creative approaches. So, you know, we're gonna try and break the mold on these concepts and reformulate this. And this is where interdisciplinarity comes in. My background is sort of, on my journey, is almost the opposite direction from Helen, only that I did start in the sciences. I did a primary degree in chemical engineering, but then did a complete U-turn and went into the humanities and studied archaeology. But because of my earlier scientific background, I went then back and did quite a lot of lab work and science in archaeology, which brought me then into kind of working with museums from a different perspective. But I as I was doing this, both in the educational setting and wider, I came to realize how working with material culture in museums, for example, has a profound impact. Just entering a museum space has a profound impact on people and how they feel and how they behave. And then working with collections like that as well has a profound impact. But at that point, there was very little data to support that. We all knew it was working. Those of us working in those sectors could see the changes in people. But then Helen and her teams in UCL, just at around the time when I joined 6 years ago or so, have started bringing out the research that supports it. And there's now very strong research that supports it, not just in the museum sector, but across the arts. And as Helen was saying, with gardening and outdoors. So we can see the impact, and now we have the data. And this is really what this program is about, is bringing those worlds together and being able to provide the evidence, as Esme was saying, about finding ways of evaluating in a non-intrusive way how people in a hospital ward enjoy music and how that benefits their recovery, but working not in a clinical way of we just want to measure, but actually working also with the patient's experience and making sure we do not cut across the benefits that these activities have to the patients, but actually working with them as whole people, I guess. And this is where the interdisciplinarity comes in, that we can't do that with one single discipline. And this is why it's important that the people working on the module come from different disciplinary backgrounds and are also interdisciplinary in the true sense that these approaches can't just come from one single discipline, but we need to combine and blend disciplines and maybe even break them down and move to something we might call transdisciplinarity, where we kind of create something completely different, where the disciplines themselves sort of disappear. I don't know, Helen, do you want to say anything else about the interdisciplinarity?
Yeah, I guess just to reiterate that, you know, interdisciplinarity isn't necessarily a concept. It's a term that describes the need and the ambitions to draw from different disciplines and find the spaces in between, like Thomas says. So the way that we'll be doing that in the programme is around drawing both methods. Esme mentioned the fact that we use both quantitative and qualitative, but as Thomas just alluded to, we're also interested in increasingly exploring new methodologies, new, for example, creative arts approaches to evaluation. And if anybody came to my lunchtime lecture, I talked a little bit about some of the challenges that lots of us face working around the lived experience and patient experience. If we really want to embed personalised care and put patients at the centre of that, we need to have methods to gather their evidence from them that is meaningful for them. So getting them to fill in loads of quantitative measures, or for example, you know, take loads of physiological measures that may not be appropriate to the particular intervention. If it's an arts-based intervention, isn't necessarily going to give you the data that you need to understand the impact of an intervention on that person. So that's why, you know, to reiterate Thomas's point, it's really important to draw from different disciplines and explore those spaces in between.
Great.
Thomas, I'm conscious of time and we've
Yeah.
only got 5 minutes, so I'm wondering about prioritising our questions.
Yeah, and there's one thing also to add, that the questions that we don't get to, they will all get added to the FAQs, the frequently asked questions, on our website. So we will respond to them in writing, and so check the MASc Creative Health website in a few days and we'll have responses. But there's one question I'm fast tracking, which is specifically to Esme. So I'm prioritizing this, and that is, how did you find the learning curve and learning the quite abstract and new ideas and language around creative health and the interdisciplinary course?
Good question. Tough, but rewarding. Your best friends are the Creative Health Report, the Marmot Review, and that's the good place to start. If you think about the more you read, the broader your vision, and you can go into different holes that way. You can just go off into different tangents, but those 2 reports are probably the best place to start. Yeah, it's a lot when you first come to it, but then it starts to all connect. So it may be quite a tough beginning, but then it starts to peter off and it's like, oh, okay, no, I kind of understand where these disciplines are coming from, how they merge, where they intersect, where they completely overlap, where they start to talk to each other. As Helen was saying before, she was talking about how you need to be non-invasive when you're thinking about, you know, figuring out what the lived experience is of a patient, and how do you personalize their care if you're just going off of metrics. You know, they can learn from anthropology and ethnographic methods. You know, the project that I was talking about with the stroke ward, that was all through film, and we looked at how to do an observational tool through film, and it was figuring out just what more exciting methods that can actually start to answer the questions that you come to this course with. So yeah, it's a hard but rewarding exercise, and it's good for your brain.
Okay, thanks, Esme. So, okay, we only have a couple of minutes. So what we do is we're going to prioritize the questions that are easy to answer here, and then there's some very specific ones on the application process and similar matters and module choices, which we can answer very easily in the FAQ sections. So do keep an eye on those. But there's one that asks about opportunities for group work and teamwork, and we can take that together maybe with the other one about the student-tutor relationship and how it is different on the MASc, on the master's versus an undergraduate program. And maybe I'll start on this one and then I'll pass it to Helen. The dissertation obviously is a main piece of work, and that's an individual piece of work within UCL. So it's not a group project, but obviously you'll be working in a group within the partner organization. So that's important. So in that sense, everything is group based, but also within the program, there's lots of opportunity for group work. There will be some assessments that are group based on various of the modules, but also in modules, for example, like Arts, Nature, Wellbeing, you will be working closely together in the class, in the seminars, with others. You know, we have sessions on gardening, for example, where we go and do some planting or weeding in a local park with Green Gyms UK, and that's obviously a social enterprise, a group enterprise where we work together to achieve a common goal. Or we have a week where we have a yoga therapist coming in and we do a yoga session, or work with clay another session. So these are very interactive sessions, entirely depend on the community, on the group element. And I think this also relates then to the student-tutor relationship, that we're keeping the numbers relatively small in order to be able to have these interactions. And the key is that I personally, and I don't think Helen and other people involved in this program believe anyway in this one-way flow of information from staff members, from expert academics to the students. But this breaks down even more on the master's course, that the idea is that we'll have a community with lots of people from lots of backgrounds, with lots of interests, and who have lots to offer as well already from their own experience, and that there will be a lot of peer learning. So we learn as well as facilitate the learning. And I think so, at least that's from a philosophical perspective, I think a key about how we'll be operating. So it'll be hopefully much more level playing field. At the end of the day, we'll have to do marking, but apart from that, hopefully this will be a collaborative effort. Helen, I don't know, would you like to say something else on this?
Yeah, well, I guess just to end, because we're really sorry that we've run out of time, but definitely, as Thomas says, you know, co-production, it comes from all of us, and we're all in it together. So Thomas and I will be gardening with you and doing clay and other activities, but also really want to share and learn from you guys as well. And learning from each other, peer learning is so important, I think, at all levels, but particularly I think as you get to postgraduate. And just finally to say that what we're organising is every week we're going to be having 2 hours where we invite a different partner and presenter to come in and talk about their work. It might be an artist, it might be one of our community partners, it might be somebody running a workshop. It might be somebody with lived experience talking about their experience, but those are going to be really informal sessions and basically more like a sort of open mic and a chat followed by a social. So there will be lots of time to be in contact more informally with us and all those people who are contributing to the course, and hopefully then a really nice way for you all to get to know us and each other. So we're sorry that we haven't got to all of your questions. As always, such brilliant questions. And what we will do, Thomas and I and Esme will read through all of your questions, and then we'll respond to them and post them on the MASc website. So please do check the website towards the end of the week when we'll have our responses up. And do get in touch with us. If you've got any other questions, then just ping us an email. It's on the website, MASc admissions, and we'll do our best to get back to you as soon as we can. And just a reminder that the application deadline is the end of May. So if you are interested in applying for this year, then please do get in contact with us as soon as possible. So thanks very much to you all for joining us. Thanks ever so much for Nikki for putting you on the spot there, and very much appreciate your input. And thanks ever so much to Esme, who's one of our wonderful students. As you heard, we're really lucky to still stay in touch with her, and she will, I'm sure, be coming and contributing and sharing her work that she's doing at the minute as part of the programme. So thanks everybody, and have a lovely rest of the evening.
Thanks everybody. Enjoy evening.
Bye.
Bye.
Bye.